Welcome to the LowCarbMD podcast. No one is beyond help. No one is beyond hope.
As we have always said, we are bringing you medical information and cutting-edge science, but none of this is medical advice. Please seek out input from your own doctor.
Hello and welcome to the LowCarbMD podcast. Tro, good to see you, man. It's been too long.
Oh my God, it's
been
been a while.
Maybe.
It's been a while, but I'm happy to see you. I'm happy to see you. And we got a very special guest today, so I'm really excited about this. So why don't you do the introduction?
I thought you were doing that. Didn't you just say you were doing the
Perfect.
introduction?
Okay, great. So I'll do it. All right.
This kid. I'll tell you, this kid Jason Fung got in touch with us. Go, hey, I think I got someone you guys got to interview, and I don't think Jason's ever wrong, except for other people who don't like him might say that, but they're wrong. Yeah, Dr. Cole.
So,
go ahead, Tro.
Oh, let me introduce him formally. Come on,
Okay.
man. You're really okay.
I was about to do that, but you can take it from me, man.
All right, perfect. I'm taking it from you. All right, today we have Dr. William Cole. Okay, he was trained as a doctor of chiropractic and then went on to get his doctorate in natural medicine. And he's actually a pioneer in functional medicine, doing telemedicine care, particularly in the functional medicine area, for the last 10 years out of his office in Pittsburgh. So very, very happy to have you. And yeah, I hear that I've heard many good things. We actually have some mutual patients you may not know, but maybe we could talk about them later. And so it's really great to kind of get you here, hear more about what you're doing, and hear about your approach to medicine and medical care.
Hey guys, thanks so much for having me. You guys are great. I mean, this has been fun so far. You guys have a great rapport with each other.
It seems
I'm
that
excited to. I don't know how you guys are off camera. Maybe it's different, but
no, we're buddies. No, we love it. No, we used to get heat. Honestly, when we first started, people to go, why do you guys pick on each other? Especially me picking on Tro. Well, like when you love someone, that's how it is.
Yeah, you can tell it's all love. I'm just joking. Yeah, but thanks, guys. Thanks for having me. I'm excited to talk with you today.
Yeah, so tell us your story. How do you go from doing chiropractic and then getting into the naturopathic type stuff and learning more of that way, and doing telemedicine 10 years ago as dinosaurs had no clue about it at that point?
So honestly, my interest in health and wellness started when I was a little kid. When I was a strange kid, and my dad was into bodybuilding. He was a semi-professional bodybuilder in the 1980s and 90s. So I thought it was normal to have your dad like lubed up with baby oil, like posing on stage and turquoise Speedos. But it turns out it wasn't. But my dad was into wellness. I know not everybody in the bodybuilding world is into health really, but he was into both. But so we go through the co-op and look at our house is filled with healthy stuff. I mean, and we didn't have the choices that we have today. I mean, there's really just very limited amount of stuff. But we'd go to local farmers. We lived in the country. So I was formed really early on. I was informed very early on how foods impacted one's health. And I remember reading a book as maybe a 14-year-old called Patient Heal Thyself for Jordan Rubin. He had ulcerative colitis and talked about how food could really impact your health. And then that evolved to me wanting to be formally trained in this. So I actually went to a school called Southern California University of Health Sciences outside of Los Angeles. So it's an integrative health school itself. There's MDs and DCs and acupuncturists and oriental medicine doctors and nurse practitioners, all kind of teaching different modalities within health and wellness. And I heard of a guy who had gone to my school. He was older than I was. His name was Datis Karazian. And even today, Datis is like one of the leaders in functional medicine, speaks for the Institute for Functional Medicine. And I knew when I was in school, okay, it wasn't just going to be health and wellness. It wasn't going to be just helping people get healthier. It was going to be specifically functional medicine. So I graduated, we moved back to Pennsylvania, where I'm from. And I was writing and speaking about this pretty early on, relatively. There wasn't much of us talking about it. Maybe me, Chris Kresser, there was like not that much of us. So the telehealth stuff was born out of, for no other reason, that I was at a different place than they were. So we had to provide them guidance and support through their health journey, through functional medicine. So then that's when I really went into the Institute for Functional Medicine and all the other postdoctorate stuff. So it's always been a passion of mine. It's just has been my passion for the past over 10 years at this point.
You know, Brian, I just want to talk about this for a second, because this is actually really important, what you're describing here. You're like, I have to be able to reach people. I have to make it convenient for them. I have to be able to support them. And 10 years ago, you're like, well, wait a second. We have, you know, freaking Skype. Why can't we do this stuff? You know, we should, as a healthcare provider, make it convenient for the patient. We should go the extra mile. And so you're thinking this way 10 years ago. You know, meanwhile, the counterparts in conventional medicine are like, no, you have to come back to get a refill of your blood pressure medication. Meanwhile, they could literally just text you the blood pressure measurement you took at home. Why are you forcing them to come back? You know, so the standard conventional medical approach is predicated on generating visits, right? Instead of generating outcomes, right? Or thinking about, how do we make this easy for the patient? How do we make it, you know, something smooth for the patient? And the fact that 10 years ago you're thinking about this, I think that has to do with, in part, because functional medicine was forced to be separate from conventional medicine, and integrative medicine was forced to be separate from conventional medicine. And so they had to do this. So I find it, you know, did you find it hard to get started? I mean, even now, I think there's a big bias against integrative medicine and functional medicine, but it's changed. In the last 10 years, it's become wildly in favor of you know, more holistic and natural and integrative approaches and functional approaches. What was it like 10 years ago? Because I'm imagining it was brutal.
It was brutal. I was so used to, I guess, seeing the division growing up and realizing that really early on, and just realized that was what I was getting into. There was a division. I didn't want there to be division. To me, it's, why did we have to have either or? Well, can't we have both and? Can't we have whatever's in the patient's best interest? Can't we have whatever moves the needle in a positive direction? Can't we go for that? And we've lost our way, where it's like so much about pontification and tribalism and us against them, and in such closed minds and closed hearts for these things. So I knew that, and that's what I saw early on. It was radical to say you could reverse diabetes. We got calls, very threatening calls, those early days, saying, how could you ever say that? You're born with type 2 diabetes. You can't do anything about it. And that has changed. Those phone calls have stopped. It's really not radical anymore.
I figured out you guys were right. Seriously, I remember.
I'm
telling you, as a medical
doctor. Did anybody
doctor,
apologize? I'm just curious. Did anybody ever apologize? All those critics you had? Sorry, Brian.
No one
of course
apologized.
not.
No one apologized. But you know, it's all right. I think now it's like, no one really says that much negative stuff. You're right. It's still not fully integrated, but it's way better than it was. Now it's like, I hear from my patients, my doctor said, I don't know what you're doing, but whatever you're doing, keep on doing it. And we're getting referrals from conventional doctors. I mean, look, it's a dinosaur to be against someone getting healthy, and that's pretty nefarious anyways. So it's like, you can't really lie when labs improve. You can't really be against that when you see the person in front of you, their quality of life improving. I mean, what are you going to say then?
No, you can. You can. It just requires a lot of dogma to do that, right? And not being.
It's getting hard to do.
Yeah.
It's getting harder. They're getting overwhelmed, excuse me, with evidence. And that's the thing for me, honestly. I remember seeing these chiropractors, people would bring this, what do you think of this, doc? I go, that's BS. You can't get rid of diabetes and throw all you get a chiropractic adjustment, you throw all away your meds and you're healed. That's garbage. And then, you know, then I started reading and understanding and seeing it's not the chiropractic adjustment. It was the different approach to lifestyle.
Right.
Change the lifestyle. As a matter of fact, I'll tell you guys, just yesterday I had this patient, she came in, she's on a drug that's costing her out of pocket $562 a month, right? SGLT2 inhibitor. And I'm like, look, and she's freaking out because I go, we have to stop it. It's dangerous to take on a keto diet. Her sugar's running I just looked this morning at 92 to 100 consistently. She was at 150 on the medicine with her terrible diet. I'm like, look, you just ate $562 and you don't need the dang medicine. And it's so nerve-wracking because they were told you'll never come off this medicine, right? And so when people come along and say we could do it different, it's shocking to people.
Yeah, it is. So it's definitely cool to see. I think the slow but even when you look at the Cleveland Clinic now having a functional medicine center, and you see these mainstream institutes, they're not opening up and spending millions of dollars on something that's quackery. I think when you see these massive monolithic things like Cleveland Clinic opening centers, like, it's time for people that are still behind the curve to wake up and realize we have to do something different to see something different.
Well, here's the thing. One of the things that I love about functional medicine, and maybe you can talk about that, exactly the approach and how it differs and how it's synergistic with conventional medicine, is the approach of, what is going on in this person's life? What are the exposures? What are the food they're putting in their mouth? How is the sleep? How is the stress? What are the hormones involved? Are there, environmental exposures or daily exposures or workplace exposures? It's just a completely, it's funny, in typical medicine, in conventional medicine, you actually see bits and pieces of this. If you go to occupational health, you see some of that. If you go to somebody who's doing metabolic health, like Brian and myself, you see some of that. If you go to somebody who does, heavy metal, exposures in pediatrics, you see some of that. But it's like functional medicine has like brought all of these things together. And so I view it as a natural, we're already doing it. It's just 3 different doctors are kind of doing it, but not doing it really well. So can you talk to our listeners about what is functional medicine? And, I know what it is, Brian knows what it is, but can you make it in a plain language? And then, and how has your approach to functional medicine, how is it unique, and what do you focus on, and what are your passions? I'd love to hear about that.
Thanks. The main differences, if I had to like boil it down to what I see, the main differences between what we do and what's done in conventional medicine, and I have no doubt the 3 of us kind of speak the same language, and we may call things different. We may have different terminologies for what we do, but we know what we're doing and we know what to look for. The first thing is we look at labs using a thinner reference range. So we're not just looking at the reference range, we're looking at the optimal healthy range, which that lab reference range is non-standardized largely, and there's a few exceptions to that, but it's based off of the population of that lab. And you'll see reference range will vary from lab to lab slightly.
You mean a vitamin D level of 30 is normal? You mean that? Right?
Yeah,
I mean, so
it's a right.
Yeah,
exactly.
Right?
That's a good example. I mean, so the optimal range is 60 to 80. I mean, 60 to 100, you really could go up to that. So it's, many people think, my vitamin D is good at 30. And look, it's relatively better, but just because something's better doesn't necessarily mean it's optimal. It's better than a 2. And that you
what do you
can
mean
apply
a
that
testosterone of 300 isn't in a 30-year-old metabolically unhealthy male, is normal. So I'm
so many people settle for, just because something's common doesn't necessarily mean it's normal. And like chronic health problems are certainly ubiquitous, but we shouldn't settle for it. And many people are just they're doing, their doctors, their mainstream doctors are doing what they're trained to do. It's not, I don't see it in us versus them. I mean, they're trained to diagnose the disease and match it with a medication. Okay, look, there's some people, of course, that need to be on medication. We're not saying pick us or pick them. It's saying like, that's needed. But we ask the question, what is your most effective option that's causing you the least amount of side effects? And if a medication fits that criteria, then okay, cool. That's another word for functional medicine, integrative medicine. So let's integrate this. But many people, the medications don't fit that criteria. It's not the most effective option. It's not causing them the least amount of side effects, yet that's the only option they're told they have. So I just want people to have agency and choice over their healthcare and be informed. And to have informed consent, you actually have to inform people. So we are looking at more comprehensive labs. So we're looking at, it's based off of a health history, but things like microbiome issues or toxicity issues, you mentioned that, or hormonal imbalances or metabolic issues, metabolic inflexibility. So we're looking at all that stuff, integrating that data, and we get super nerdy and put things on spreadsheets and we color code them from an educational standpoint and for us visually just to see improvements. And then we can quantify that improvement over time. So we're clinically monitoring people and coaching them, educating them. So the way that I run my functional medicine center, and it's different for different people, but we do mainly a concierge approach because we do a lot with really complex autoimmune cases. And those people they're just very complex cases. They're not quick fixed. They take a lot of due diligence, a lot of thoughtfulness, a lot of bandwidth as far as just attention. So we've seen people that have seen dozens of doctors, both conventional and natural doctors, but and I would say certainly they're better off than they would be if they hadn't done all the things they've tried, but they're still spinning their wheels and they're still missing pieces where they want to take it to the next level. So I'm normally with my patients for a year to 2 years, really working at these things and getting their labs looking great, getting them feeling better, dealing with these underlying reactivities and these flare-ups. So that's the majority of my patients.
Yeah, you know, just yesterday it happened to me. I had a patient come in and I'm looking at her complaints and I'm like, a direct primary care patient. And I was like, first question, how's things at home? You have headaches, back pain? Her life is a disaster. And she said, doctor, I don't want to waste your time with this stuff. I want to talk medical stuff with you. And I'm like, trust me, this is affecting your medical stuff, right? Your blood pressure's high. You have heartburn. You can't sleep at night. You have insomnia. You have headaches. You have tension. Your neck's sore. Like, this is what we have to look at. By the time she left, her blood pressure normalized. She could take a deep breath because, you know, when you're going through this stuff, I think the problem with modern medicine, and I had all the time in the world. I go, hey, I got time. She goes, I don't want to waste your time. I go, I got time. I don't have a patient scheduled for an hour. Let's talk. But, you know, that kind of stuff, I think Western medicine, I mean, she also has a membership at a big HMO. And she goes, they spend 6 to 8 minutes with me and that's it. They don't talk to me like you do. And like, you know, it's just amazing what you can do in functional medicine when you stop and you go, okay, let's see what's happening. Let's look at the root cause, as Ivor Cummins says, you know?
Yeah, absolutely. You're right. You're right. And it's those things that are, it's not and that's what I try to educate people on and inform them on. It's not me versus that conventional doctor. It's the system at large is not set up. Because here's the deal, is that most of my colleagues in functional medicine trained through the Institute for Functional Medicine, they're all conventionally trained. They're all within the conventional system, the majority of them. But they go back to their typical practice and they don't have the time to even implement the things they're educated on. So it's not always the education, which it is that, but even if a doctor was trained in functional medicine or health and wellness or metabolic flexibility, the system's really not set up for these longer form conversations that need to be happening. It's not going to be solved in 5 minutes. Take this pill, see you later. It's not going to be solved. And that's the statistics of chronic disease shows that for itself.
Can I bring up a case with you, Dr. Cole? So
Sure.
I had a trial lawyer in my practice, great guy. He was in the diabetic range and he was pretty normal weight, maybe just a slightly increased adiposity. And he was low carb. He was exercising about 15 to 20 minutes a day, really did well. And I put a CGM on him and I was so baffled by what I saw. First of all, I'm sure you could talk about this at length. When he drank alcohol, okay, the next day, his morning rise was much higher. His morning rise in the sugar was much higher, okay, pretty consistently. And then every day of the work week from 12 to 5, his blood sugar was up by about 100 points. And I'm like, well, what happens between 12 to 5? The guy is a trial lawyer, top trial lawyer, making oral arguments, highly stressful situation. Yeah. And that was driving his quote unquote diabetes, you know? So, I mean, I'm sure you discover things like this all the time, but I was like, I was completely flabbergasted when I saw this, just because I had time to listen to a patient, monitor the patient with objective markers, and see how their life and their health interplay. So can you talk about that interplay between life and health?
Oh my goodness. So it's one of those things where even me in functional medicine, I get, because you see the power of food and you see the power of lifestyle changes, like as far as clinical nutrition is concerned, that sometimes, and especially if it's a passion of yours, like which it is for me, but then even with us, we could be so myopic and not give enough attention to things like stress and things like trauma too, with people with autoimmune issues specifically. But you could be eating the best foods under the sun and you'll move the needle. But I see countless of cases over the years where they're stuck at this plateau. They're better off than they were because they got their diet right. That was the first start. But if they're serving their body like a big slice of stress every day, that's like garbage for the soul. That's junk food for the soul. And I see people in unhealthy relationships, unhealthy jobs, unhealthy, like traumatic experiences. They're taking care of an ailing loved one where their health just takes a bad turn for the worse, and they're doing all the things, but they don't realize that that poor sleep or that stress during the day is impacting their blood sugar, their blood pressure, inflammation levels, their autoimmune flares. I mean, it's profound. So we need to, as healthcare providers, we need to give that the attention it deserves. And that's tougher. That's more difficult, because it's easy to say, don't eat these foods, take this protocol, do that. But how do you tell somebody to, like, your job is not serving you? Most people can't quit their job. So we have to, like, okay, how do we really create a stillness and some parasympathetic support throughout your crazy, stressful day? And that's the thing. And look, some people over the years I've seen quit their jobs because of this. And they're at the point where they're like, you know what, my health is more important. I actually am going to change careers. But most people, I know that's not realistic. But it's that when you have that longer form conversation of how's your life serving you, there's a reckoning sometimes big reckonings, moving, sometimes it's divorce, sometimes it's changing their jobs. These are the things that I've seen.
You know, I just want to talk about that, because you hit something really important. At least it empowers the patient, right? Now they know, okay, then they can recognize what is leading to poor health, and they can start to think about how they will manage it, whether they're going to meditate before they go and make their oral arguments as a lawyer, or whether they, consider reducing their hours or changing their job or getting better sleep. At least they know the cause. And 9 times out of 10, the conventional approach will never look at what is the cause. So I'm with you. I want to segue here, and Brian, I don't know if you have any other question, but I wanted to talk about autoimmunity because you brought it up.
Well, I just want to throw one thing
times.
in, Tro, from a chiropractic, because Tro and I have taken heat from medical doctors saying, why do you call chiropractors doctors? They're not real doctors. I'm like, look, these guys have studied nutrition. Like, we didn't study all this stuff too. We had to learn on our own because of our own personal struggles. And I will tell you from personal experience, my chiropractor, Dr. Grant, thank you, love you. There's a lot of times where I was miserable. My back is out, my neck was out. Now going keto, it changed a lot of stuff, so I don't get to see her as often. But I would see my sugar spike when I was in pain. Like, if my back's out, I'm getting sciatica, all that kind of stuff. And I have a patient, she's spiking her sugars whenever she goes to physical therapy. Like, before she even goes, her sugars are spiked because she knows it's going to hurt because she just had a knee replacement. So there's a lot of things like that where we don't appreciate how we could all work together. We're not mutually exclusive. Because someone sees me doesn't mean they can't go to a functional medicine doctor, doesn't mean they can't go to whoever for their hormones. It doesn't mean they can't go to a chiropractor. So people think when they hear functional medicine, they're thinking, oh, you have cancer, just throw all your pills away and I'm going to give you this magic potion and you're going to be better. And that's not what anyone's saying that I know who's reputable. They're saying, look, we can support you through chemotherapy. We can support you through, whatever, and hopefully taper down your meds. And I think we're seeing it enough. I mean, my biggest compliment, I don't know if you saw this yesterday, Tro, this guy came in with 4 shopping bags of meds. He goes, I don't need any of this stuff anymore. Can you give it to someone who can use it? It's probably $4,000 worth of medicine the guy can't use. I can't use it because I don't put people on insulin anymore. I'm taking them off too, so I'll have a surplus everywhere. So if I started insulin sales, I'd be a multimillionaire maybe by the end of the year, Tro.
It's interesting, like the monopoly over the word doctor, and it is like a very hot button thing I've seen over the course of my career so far. And there are many types of doctors. I don't understand why that there's such a even wherever you stand politically, it's interesting. Even with Dr. Jill Biden, that was like such a thing where it's like, why is she calling herself? That's completely different. But there's that word is very much like, it's mine and it's only for this group and it's for nobody else. Call me whatever you want. Call me captain, health captain. I really don't care. I'm getting people healthy. You can have your title.
That's a huge thing. We had Ben Bickman on from BYU, one of the sharpest guys. He's had a huge influence on my practice, my life. He's a researcher. And he goes, guys, just so people don't be misled, let them know I'm not a real doctor. I'm like, dude, you're a real doctor. Trust me, because all this stuff you've figured out in the lab, I can use to help people. And I get the glory. That's the best kind of doctor. I get the glory and he does all the hard work in the laboratory, right? But what that brings out is how much we have to collaborate and say, hey, if you got a better treatment for this than me, go for it. Western medicine treatment of back pain is a disaster. It is. It just is. You go, here's a pill, here's an anti-inflammatory. Why are they inflamed? Oh, maybe we should look at that, right? So you start realizing, like, one of my guys was here. He wanted a total hip replacement. We got his diet under control, sugars under control. He's a miracle. I'm going to interview him on the podcast, Tro, if you stop giving us all these other guests. It's a miracle. This story is like, you will not believe it. You have to hear it directly from him, because if I say, you won't believe it. But the guy's running now. They wanted me to get an MRI of his hip. I go, why don't we just give keto a little while and just see? He's not miserable. He's running and hiking mountains. And his daughter goes, it sucks because I can't keep up with him and it's embarrassing. And this guy was waiting to die. He thought he would be dead by now. He goes, I can't believe I'm still breathing, because he was done. He's 66 years old, checked out, right? So these are the kind of things when you talk like this, people go, oh, that's crazy. That can't happen. It does. I'm gonna have him on video discussing it.
Yeah, countless of times. Yeah, I know. It's amazing to see. It never gets old, for sure, when you see something like that happen.
Okay, Troy, you can talk autoimmune now. I just wanted to interject that.
No,
I like
I
to
mean,
do
look, we're talking about bottom line. It's funny you said, call me health captain. I'm certified as a health coach through ACE. And the reason why I got that certification was because I wanted to be able to do more and do better for people. And I wanted to be able to motivationally interview them and kind of actively listen and learn these basic techniques that guide people to health, not just dictate people to health. And so I love that, health captain. I think I'm gonna get a shirt that says that, because I absolutely love it. But you've mentioned autoimmunity, and I want to talk about that because I have to be honest with you, that is something that modern medicine has ignored. Why is why does autoimmunity exist? Okay, once it is in that definite phase. So like, if somebody's honeymooning as a type 1 diabetic, or somebody has TPO antibodies or antithyroglobulin, antithyroid antibodies, but their thyroid's still functioning, what can they do? I mean, that is what people are talking to me about. What can be done? So, what is the origin? What do we know about autoimmunity, and what can we do? And then once the organ is spent, what do we do then? How do we monitor? What's the best we can do in the thyroid and all these issues, and maybe we could talk about diabetes as well. So help me, I think there's a lot of gaps in traditional medical care. It's just like, well, autoimmune disease, I don't really know. And we'll wait for your organ to die, and then we'll give you hormones, So that's, Brian, do I have it wrong? Is that that's pretty much the conventional approach to autoimmunity? Let's wait for your organ to die, and then we'll give you.
Then we'll try to bring it back to life. We'll do CPR on your organ and see what we can do, and then it's too late. Yeah, exactly. I think,
and we're just
fatty liver
give you the
disease is a
hormones.
perfect example. We see it. People go, yeah, I've had this for like 12 years. I go, do they tell you anything? Well, you're drinking 6 sodas a day. Maybe we cut that out. And now their numbers are normal. And that's the thing when we were talking about lab values. You have to remember 88% of Americans are metabolically sick. So we're comparing your labs to metabolically sick people. So if you're one of those 12%, you're going to lie outside of the normal because you're normal. It's just so crazy to me. So,
but for autoimmunity, right?
And no one wants to get a C in a class. You want to study and get an A, right? You don't want to get a C or a D and say, okay, I passed barely. So I think that's where we're at health-wise. Do you want to be at an A health, or do you want to be at a C or D health?
Well, I think, don't you face that question with autoimmunity? Like somebody has, anti-TPO antibodies or antithyroid antibodies, or they have, these autoantibodies against the pancreas, and they're just honeymooning right now. And they come to you and they ask you, well, why did this happen? One, and what can I do about it? And our approach right now is just the medical approach per the guidelines in the medical literature is wait till the organ basically dies, right? The pancreas goes out, that's type 1 diabetes, and give them insulin, right? Or wait till the thyroid burns out and then give them thyroid replacement. Do I have it wrong? Am I being wrong? And Brian, am I presenting modern
You're probably
medicine
wrong, but you're probably right at this one.
No, come on. I'm being honest.
No, you're totally right. I agree. Look,
You know?
when I see, Tro, if you get type 2 diabetes and your doctor didn't warn you at least 6 months in advance what was going to happen, there's a problem, because we know 10 years in advance. We see the numbers. It's like your check engine lights flashing and flashing and flashing. Go, I'm just going to wait till the engine blows up, then I'll see what's wrong with it. It just doesn't make any sense, because I'm telling you, these guys, medicine is going to change because they're going to see our numbers and they see what we're doing with people. And, I think that's it, of having that approach of preventive care. Like people, the problem is people don't want to pay up front. The health insurance has no interest. Why? Tro, you know as well as I do, the more diagnosis codes that patient has, the more the system gets paid from the government. And so if you take away diagnosis codes, the doctor gets paid less, the insurance company gets paid less from a Medicare perspective. So you want your patients to be sicker to make more money. So my patients, I tease them. I was teasing a guy yesterday. I go, look, I'm going to make so much money off you because I'm going to keep you around forever. And every year I'm going to make some money off you. If you die in 2 years, I'm going to lose money, man. It's not about you. It's about me making money. And I was joking with him, but the point is, look, we can extend life by doing the right thing. You do polls. The most important thing in life is your health. Number 2, family and friends. That's what the polls say, right? But we don't want to put money into our health. It's incredible to me.
But we can't even address it. So Dr. Cole, what should we know? Like, let's go back to these questions. What can we do? Autoimmunity, why does it happen? Or what do we know that the conventional medicine is not paying attention to? What can we do about it before the organ fails, if anything? And should we change the approach? Should we change the medical approach?
We absolutely should. You're right. Autoimmunity, and there's so many other examples of this beyond it. I mean, you talked about metabolic issues, chronic health problems, mental health issues. I mean, there's so many examples beyond autoimmunity, but autoimmunity specifically, they're really given very few options, like you said. So there's this larger autoimmune inflammation spectrum that you kind of touched upon. There's silent autoimmunity on one end of the spectrum, which if you ran labs, you'd see the thyroid peroxidase, you'd see the random, whatever antibodies we're talking about, we'd see markers, we'd see positive ANA, et cetera. But the person feels decent, they feel fine, they don't know anything going on. Stage 2 is that autoimmune reactivity, which is where you kind of were referring to. It's the symptomatic, they know something's not right, their life's being impacted, but they're told, it looks autoimmune, or they're not really getting any clear answers. No doctors are really, like 2 doctors are not agreeing on it. One said it is, the other one said it isn't. And then stage 3 is a full-blown autoimmune disease where it is officially labeled. But like you said, I mean, you have to have 70 to 90% destruction of a part of your organ before mainstream medicine will say, well, if it's destroying the adrenal glands, it's Addison's disease, or the myelin sheath, it's MS, or it's the villi in the gut, it's celiac disease, or the pancreas, it's type 1 diabetes or type 1.5. So research estimates it's about 4 to 10 years prior to that diagnosis is when things were brewing on this autoimmune inflammation spectrum. So my job and my passion is really, no matter where you're at on that continuum, what can you do today? So we see a lot of people with stage 2, we see meaning reactivity, they have markers, but they're not diagnosed. And then stage 3, we see a lot of people that are diagnosed. The body is amazingly resilient. The healing capacity is amazingly resilient. So once it's destroyed to the point where you can't produce, whether, if it's insulin or thyroid hormones, we're not talking about regenerating that where you can get off of those replacement hormones if the damage has been done. But anybody that's diagnosed with an autoimmune disease will tell you, this is so much more than that. I need to stabilize my health because my flare-ups are happening. My quality of life's in the gutter. We need to get them healthy. But there are many people where they still do have function left, and they want to prevent that from getting to the point where they do need to be on that. And look, anybody that's diagnosed too will tell you it's no walk in the park just given steroids and immunosuppressants. And I mean, why wait till the body's destroyed enough of itself to then be labeled to only be given those steroids, immunosuppressants, or replacement hormones? What can we do today? So that's really my work, is to find out what's driving this. Research estimates that 1/3 of this autoimmune puzzle is genetics. So a component of it, you'll typically find family history of different autoimmune problems, but 2/3 is epigenetics that awakens that genetic predisposition. So we're talking about stress and trauma, underlying gut issues, which of course is 75-80% of the immune system. So we have to look at where the predominance of the immune system lives to understand autoimmunity. So we look at all different facets of microbiome health, and we look at chronic infections. We see a lot of recurrent reactivated viral infections, like Epstein-Barr virus, cytomegalovirus, mold toxicity, mycotoxin triggering autoimmunity, Lyme disease and co-infections to Lyme disease triggering autoimmunity, and chronic fatigue syndrome. So that's typically what we're seeing. Okay, what's pissing off the immune system, so to speak? What's triggering that molecular mimicry, that case of mistaken identity, what's causing the immune system to lose recognition of self? Like, why is the immune system thinking that the thyroid or thinking that the pancreas is a virus and attacking it? So when you start to deal with that stress load that the immune system's under, you can dramatically, in most cases, decrease the severity and the frequency of their flare-ups, or preserve the tissue they do have to have normal function. So that's not a quick fix. It takes time, but it's definitely something that I love doing. I love being a part of.
I wonder, maybe you can tell me about the data that supports this. I'd imagine if you can modulate somebody's interleukin-6 and TNF alpha down with diet, and you get somebody their inflammation low, like through CRP, are they more or less likely? I mean, I'd imagine they're less likely to have an exacerbation, right?
Yeah.
Like, is there any data that supports that if somebody's baseline CRP is lower, that they may have less exacerbations? Or, you know, I don't know if there any data like that exists.
Yeah, I don't know specifically, but I mean, look, these people have Th1 and Th2, or they have dominance of one of these. You have a lack of T regulatory cells. So I think that's that's why one of the many tools that I love so much within this field is a ketogenic diet and fasting. Because what does it do? I mean, we know what it does, but for people that they think the ketogenic diet is just about weight loss and losing weight, which certainly is an amazing tool for that too. But it's for these autoimmune people, many of them are underweight, and they're like, I don't have to lose weight. No, wait, like this isn't just about like only people that are struggling with weight loss resistance can do this. We can actually tap into our body's own healing pathways to downregulate these inflammatory cytokines, like you mentioned, all these NF-kappa B pathways and the COX-2 pathway and the NLRP3 inflammasomes, all these pro-inflammatory cytokines. We can lower that naturally and upregulate all T regulatory cells. And modulate the gut microbiome. I mean, there's so many key mechanisms that you want to be supporting, and in ketosis and beta-hydroxybutyrate actually really does facilitate it. And same with fasting as well. Obviously, two sides of the same coin. But without a doubt, I've seen it on an hourly basis that people can dramatically have agency over their health if they just give their body the time to do it. So.
Yeah, you know, that actually, a lot of this came up yesterday because, you know, I have a lot of respect for Jason Fung. He really has done a lot for me, and I see his integrity, I see his character and all that. And I see him attacked mercilessly, like mocked, made into a clown, like stuff like that on social media. And I'm like, these guys don't understand what he's saying. They don't get it. And there's people that I've respected that I've lost a lot of respect for because I'm seeing it clinically. I'm like, look, intermittent fasting, I'm seeing the visceral fat decreasing. I'm seeing the sugars normalize. I'm seeing it, and I have it all documented, guys. So be careful who you make fun of, because I'm telling you, Jason's right. A lot of people are right. And it's like, look, guys, at some point, you know, we take from each other. If I mock you and you're not going to share anything with me, if I go, hey, man, teach me about thyroid function, right? And maybe I say you're crazy at the end of the day, or maybe I say, hey, let me try and see if it works. But I think there's such a mocking because they're really on him about this calories thing. Tro and I have had debates about calories, but it's really, calories do matter, but ultimately we're looking at immune function, and we're looking at hormonal balance changes, right? So as a matter of fact, talking about interleukin-6, Tro, interleukin-6 intrigues me. You work out, you kick out interleukin-6, interleukin-10, interleukin-15. Ben Bakiki was teaching me about this. He's a biochemist genius who's a musclehead, right? But, you know, when you start looking at this stuff and you start saying, wow, all these things tie together and it makes sense, you know, but interleukin-6 with acute exercise spikes. Guess what? If you give an interleukin-6 blocker, what happens? Increased visceral fat, increased LDL cholesterol, no weight loss, weight gain. Maybe that's not a good idea. Maybe that could cause more problems than it is. If visceral fat's a problem, that may not be the best solution for our problem, right? So there's a lot of stuff like that, and it's too complicated for me. So I have the smart biochemist guys look at that and say, hey, tell me how do I manage the patient, and let me see how it works. So I think there's a lot of stuff like that where we're going to say, is insulin good or bad? Well, it depends, right? If your sugar's really high, you want to have insulin go up to get rid of it. If it's really low, then you don't want a bunch of insulin floating around causing problems. So I think we've been trained to look and say, okay, like for me, really, if I see someone whose sugar's out of control, their doctor's saying, well, there's no need to check an insulin level. I was like, I've seen it both ways. I can't predict it. I've seen people with through the roof 98 insulins, and I've seen them at 2 insulin. Right? But if they're metabolically healthy and it's 2, you're great. If your A1C is 10.8 and your insulin's 2, you're in big trouble, right? So I think those things, when you look at the we're trained. I think once you see it, you can't unsee it. We're looking at the big picture. And I think that's what you're saying. That's what Tro's saying is like,
Right.
look, it not all things are good or bad. It has to be in the right levels.
Yeah. Context matters. You're absolutely right. It's true. And from an educational standpoint, when I'm talking to patients about that context, it's really cool to see that light bulb come on. Like, oh, like I get it now. No one ever sat down and took the time, like we keep saying, to even inform them about their health. And it's when you empower someone like that, a lot of this stuff falls into place because they're empowered to then take action on their health. They're a partner in their own health. They're not just doing something because a doctor told them or taking this pill because someone told them. They actually know this will yield a result. And when you start tracking labs for them, that's the best thing I've found for sustainable wellness is informing people about the context of their health.
Yeah. And so I was going to ask you, how did you come across Jason? How did you guys cross paths and start working together and all that stuff?
You know what it was? I hosted a keto talk for 3 years. So that's I think where I first met him. And we met at a health event years ago in Arizona, actually in Tucson, for Mind Body Green. It's a health website, and I've written for them for a long time. And he was there to speak. So we were hiking through the desert. We already knew of each other, but it was the first time we got to really spend time together. So that was a while back, and he's a great guy and doing some amazing things. It's funny. I kind of stay off of social media to the point of like really looking at what people say. I didn't realize, it's not surprising, but I didn't realize how much negative, if he's getting some blowback from certain things, it's unfortunate because he is such a man of integrity.
And I think they're going to be embarrassed really because I interviewed him for my other podcast, which I'll give a plug for, Life's Best Medicine. I'm like, Jason, let's drop the scientific stuff. What's Jason Fung like? And you see what his motivation is, what he's done with his life. He's a remarkable person, man. He's like, you're in the presence of greatness around him. That's why I get offended. And obviously Jason can defend himself, and I'm not an apologetic guy, and I can't think for someone else of what their motivations are. But I'll say, look, when someone's falsely attacked, and then the hyenas, how they just attack the wounded animal type thing, and they just all pile out as a pack, or coyotes. Like I like a, and he's remarkable too, Sean Baker. Like he's a lion. He doesn't really need anyone to defend him, but don't mess with Sean. Don't back him into a corner. Trust me on this one, man. This guy, there's way more to than what appears on the surface. But anyways, what I'm saying is like the hard thing is, and this is my warning to myself, I don't mock people. I try not to. I try to absorb because they could be right and I could be wrong. If I make them look like an idiot, that stays on the internet forever, right? So, but I think it's just about being a decent person. And I know he made me and Tro broke because we said no sponsors for this podcast because we don't want to have an appearance of conflict of interest where there wouldn't be. But it was him who said that. And people, oh, he's out there to make a buck. I'm like, he was the one who adamantly said this podcast. So he cost me and Tro $1,000 last year, man. So I'm upset with him, but I'm still defending him. Put it that way.
It's great.
Tro,
can
I borrow some money, man?
Oh man.
How about the Patreon people, man? We should get them. Do we have any questions up?
Yeah, you know what? Guys,
I can't multitask, Tro, so you got to do the questions because we're probably not asking the right stuff.
No, I'm gonna ask one more question before we get some more. Guys, if you have questions, just pile them in, and we'll be happy to get to them. So I want to come back to autoimmunity because we have so many questions. I think autoimmune, we talked about it globally. What revs up the immune system? What decreases it? We have so many patients. I see so many patients who are in that thyroid, they have those thyroid antibodies and they've experienced some maybe episodic symptoms and they're wondering what can be done before this thyroid burns out. Like, what should they do? Like, if there's the low hanging fruit, for most of the population what would you say to that person, and they're desperate. They're like, I don't want to lose my thyroid. I don't want to be on thyroid medication forever. What does the evidence say, and what's your general approach?
Yeah, it's a good question. So the analogy that I use for this is people with a family history of autoimmunity that have some autoimmune components or autoimmune reactivity issues in their life. It's akin to sort of a smaller mug size. Like, we all have different mug sizes. That's our tolerance for stressors. Some people have massive mugs. They could smoke and drink and get away with stuff, right? Their labs are pretty decent. You're like, how the heck could they get away with all this stuff? Some people just do. Some people have these smaller mugs and they're like doing all the things, eating way better than their family members, and they can't get away with anything. They feel miserable no matter what they do. So you can't change your mug size, but we can change what you put in it. You can't change your genetic tolerance to things, but you can change what you put in it. So that a third of that puzzle, autoimmune puzzle, is that mug size. It's a component of it. Their body is just very more apt to be irritated by things and be triggered by things and be flared up by things. So we have to understand the 1/3. We look at methylation gene variants and different genes that are associated with triggering autoimmunity or associated with autoimmunity. But we also look at the 2/3, which is what's filling up that mug. And that is, I mean, it starts with food, of course. I think most of your listeners will know this, but we have to look at the foods that are most likely to irritate the immune system, to disrupt the microbiome, to increase intestinal permeability or trigger leaky gut syndrome, which can create that seminal event called molecular mimicry when the immune system cross-reacts against the food or the bacteria against the organ, the thyroid or the pancreas or whatever else we're talking about. Grains, of course, should be considered to be completely removed, especially the gluten-containing grains. But I would say even the gluten-free grains for people with autoimmunity are going to potentially be problematic. Dairy is one of those foods where it's beloved in the low carb and the ketogenic world, but many of these autoimmune people, their immune system doesn't do so well with it. You can get better versions of it, of course. You can get the A2 milk and the cultured dairy and the grass fed, and that's going to dramatically decrease the risk factor of eating that. But I would say, at least for a while, to err on the side of this is probably going to irritate my immune system. And industrial seed oils, which is really good for nobody, but canola oil, vegetable oil, things that are higher in inflammatory fatty acids, and then added sugar, which is kind of a no-brainer. But even I really want to educate people on just reading the labels, and because there's nice sounding, pretty sounding euphemisms for sugar, it's still sugar. So you need to inform yourself on what's in it. It may not just say sugar. It probably won't say that. From a marketing standpoint, it's better for brands not to. So I think that those are what I call the core four. But then the next level is like important for people with autoimmunity. That's the 4 more foods would be nightshades, which are peppers, tomatoes, eggplants, goji berries, white potatoes. The alkaloids can be irritating to these people, not all of them, but some of them, specifically people that have things like rheumatoid arthritis, musculoskeletal inflammatory issues, people with fibromyalgia, people with GI issues, people that have ulcerative colitis, Crohn's, things like that. And nuts and seeds, again, another loved food in our world. I love nuts and seeds, it's fine, but for these people, for some of these people at least, that's problematic. And you can soak them and mitigate the risk factors with that too by making it a little bit more easy on the gut. But that's something to think about. Legumes, you can pressure cook them, but even those can be problematic. And eggs. I love eggs, but some of these people's systems don't love eggs. So I don't have an agenda on like, this is exactly what everybody needs to eat. My job is to find out what their body loves, and let's stick with that, and let's decrease the amount of things that the immune system is being irritated with. So those are foods to consider to take out or reduce or eliminate for a time at least, and then we can try reintroducing them. But then beyond that, those are the low-hanging fruits. But beyond that, I think labs are important because we can see what else is irritating the immune system. Because I'll tell you what, most of my patients, they've cleaned up their diet already. They're really not eating lots of those things or at all because they've been forced to, because they've had to be their own doctor because they're not getting answers. So they listen to amazing podcasts like this, and they know all these foods do irritate them. They take them out. They're left with like 2 or 3 foods they can eat, which is not sustainable. And it's driving them crazy, and as far as stress levels are concerned, because there's no wiggle room. And we need to look at what's perpetuating this inflammatory storm, because they've removed all the foods, but they're still struggling. So at that point, these underlying things like chronic infections, trauma, underlying gut issues, and toxicity issues need to be looked at, because that stuff, even when you do clean up the diet, those things can still perpetuate that storm.
And are you looking, when you're looking at these food intolerances, do you go clinically? Do you use lab work? You know,
Oh, yeah.
what's your approach there?
It's all labs. I mean, it's all labs to know what I'm doing. I don't want to shoot in the dark. I want to know as definitively as I can know. I know there's no perfect lab out there, but I'm using the best data we do have, the best diagnostics we do have, to at least get a really good perspective, the best I can have, to see what's going on. We want to look at the stones, so to speak, that are most likely to have something underneath it. And a lot of these things are called great mimickers or great imitators for a reason. That's not just Lyme disease. A lot of the, like mold or Epstein-Barr virus or even trauma can elicit the same symptoms as Lyme disease for some people. So you have to really be open-minded to the fact that just because it looks like a duck doesn't necessarily mean it's a duck. It could be like a goose, a duck imposter, is some other, strange thing that you never thought it would be. So labs can illuminate that and know, okay, look, yeah, I thought it could be that, but now I know it pretty for as definitively as I can know, this is what's going on.
Hey, Troy, I think we made a mistake. Dr. Cole he's not dogmatic enough. It's gonna ruin our reputation, man. What are we gonna do? He's open-minded. He looks at the patient in front of him and tries to figure out. That's so dangerous. I'm joking.
It's real dangerous.
It's critical, right? Because just because eggs work for me doesn't mean it's going to work for you. And I think that's what's funny is we all get pigeonholed and you go, okay, let's adjust this. Let's take the nuts out and see what happens. Let's take the eggs out. Let's try, crazy Sean Baker's probably the smartest guy in the room because his diet, like very few people are going to have a problem with that, right?
Took it all. Other than the Lyme disease people that have beef allergies, then they're screwed with that. But
exactly. So those kind of things. And I was going to ask you just before Troy gets to our question, do you do food allergy panels on people routinely or?
Not per se. No, we run them for food sensitivity testing later on. Typically at the beginning, their immune system's so in overdrive. If you run one of those labs, you're going to have 100 foods being positive, and it's like, what the hell can I eat? I can have air and ice cubes and like low lectin bark. It's like I have nothing. So to me, it's like, let's calm down this immune response and deal with what's driving that immune response. And then later on, those food sensitivity testing can be helpful. At the beginning, at least for this population, it adds to their orthorexia and anxiety around food. It's like, okay, look, let's just not look at that snapshot in time right now because it's not actually helpful from a real life standpoint.
Awesome. Yeah, that's awesome. And there's a lot. I do minimal lab tests and try to see how we do first and then say, okay, let's do stuff later. Because I'm trying to save money for the patients, but also
totally
it can be overwhelming and confusing and people don't know what the heck to do with the data. That's really important.
Yeah.
Tro, I have to make an observation. It's going to bug me if I don't say it. Dr. Cole looks just like you're not going to know this group. You too, Bono. If you were in the right glasses, I would just tell people, "Hey, look, I'll take a picture and like show people." You tell so for people just
jealous
listen,
of his hair, man.
Right?
You're just jealous of his
got
hair.
that look and young Bono back in the day when I was young and he was a bit younger. Yeah.
Well, that's a compliment. I appreciate that. I do need to get my hair cut, so I apologize for that. I'm getting a haircut tomorrow, so it's a little long right now.
You've been compliant. I need a haircut too, man. Tro is really compliant. Tro, you're really compliant. You're way ahead of the curve. You knew this was coming. You just shaved it off, man. It's cool, smart. You're good. It's good thinking. Yeah, okay, like Tro, get the questions, man. We're gonna get yelled at by the Patreon.
We're doing this, man. We're doing this. We're doing this now. Okay, first question. All right. Do you feel that exercise could be a good way to deal with the negative effects of stress from a stressful job, stressful relationships?
Yeah, absolutely. For multiple different reasons. Obviously, we know exercise is so beneficial. Do something that really gets you in the zone, though. I think someone's attitude around exercise can create a different outcome. So shift your perspective on things like exercise and food and fasting, all this stuff. If you have someone that hates what they're doing, it's going to produce a completely different outcome than someone that really loves. Doesn't mean they always want to do it, but they still like have a positive mindset towards it. It definitely can. But look, exercise is a hormetic effect, just like fasting, that when someone's going through a stressful time, sometimes they actually do need to bring some parasympathetic things in their life. So move your body, but maybe it's a walk in nature, like go hiking. Maybe it's something like yoga or for some people, it's still the gym, because for them, that's their meditation. So it depends on the person and the context of the case, but yeah, it's a good way to deal with stress in general.
Okay, awesome. I agree 100%. I use it for stress release. Okay, here we go. All right, this is a great question. All right, what are the best tests to show kind of where the thyroid is at? to get an understanding of the thyroid function. Certainly we use TSH, T4, T3, reverse T3, but what are you looking at when you're assessing the thyroid?
Yeah, thyroid stimulating hormone, or TSH, which is a pituitary hormone, but the optimal range is depending on who you ask, but the main optimal range through the Institute for Functional Medicine is about 0.445 to 2. So that's a tighter range. That reference range will probably about 0.45 to 4.5, some even higher than that. So you want to look at a tighter optimal range there, but you cannot hang your hat on just a TSH. You have to look at total T4, total T3, free T3, free T4, look at reverse T3, look at thyroid antibodies, TPO and the thyroglobulin antibody, and the Graves' disease TSI markers as well. So that's all of that just from the thyroid. But look, the thyroid doesn't operate in a vacuum anyway. So you have to look at liver function and gut function, in my opinion, too, because 80% of the conversion from T4 to T3 happens in the liver, 20% happens in the gut. So if someone has lower T3 syndrome, their total T3 is lower, their free T3 is lower. It could be something with the liver and the gut as well. So you have to understand the full context of thyroid hormone metabolism sometimes, not all the time, but sometimes it's helpful for things that are stubborn and aren't moving in the direction that you're wanting it to.
So what do you do with people with really high anti-thyroid antibodies, but thyroid function, everything looks normal except you see that marker? Do you just watch them closer, or just wait for it to happen, or what do you do in that case?
Yeah, I have a conversation because sometimes, and sometimes it's semantics, and some doctors will say, well, yeah, you have Hashimoto's disease, but what's going on, it's exactly what you just said. The antibodies are high, but the TSH is optimal, the total T4, total T3, free T3, free T4, all normal, and the antibodies are high. So it's technically not Hashimoto's. It would be, depending on how they feel, probably autoimmune reactivity if they're not feeling well. So at that point, we would want, I love that opportunity. That's like, whoa, okay, we have function left. We can actually preserve what's left. That's such a place of grace that I don't always get to have. So I want to clean up their life to let's do everything we can to mitigate that getting any worse. That's the grace period to do something about it.
Awesome.
Yeah,
Thank
I've seen people in diabetes type 1, they can, once those antibodies are there, it's truly, I haven't seen anybody ever completely walk away from type 1, but I've seen people honeymoon for years. Yeah. I mean, 3 to 5 years, I've seen people honeymoon, meaning where they don't need insulin. Mm-hmm. So something certainly can be done. We don't have a lot of data on this. It is my belief that eventually, look, there are things you can't control that are going to rev up the immune system: allergies, exposures, sickness, corona, whatever. You're going to be exposed to something, flu, something, right?
Sinus
infection,
exactly. All that kind of stuff.
Yeah,
absolutely.
Something's going to happen. It's going to rev up the immune system, and that organ may stop functioning, right? But we've seen people get prolonged kind of honeymooning. It is there. It certainly is possible.
And I'll throw one thing in there. One of my patients is an oral surgeon in town, and he goes, Brian, your patients, when they come in, we're stoked because their oral health is so much better than everyone else's. He said it's awesome. Notable, it's noted, and he goes, it's making a difference in their oral health. I can tell you that for a fact, right? That's pretty cool.
It's very cool.
Okay, let's see. We got some other questions here. Okay, do you do routine testing or for food intolerance, or do you mainly do that for somebody who has, who do you do that testing in? Who's your ideal patient? And, how do you use that food allergen testing? Because we get a lot of patients asking about it. So I think that's a good question to take right now.
I don't run it as a first go-to very often because, like I mentioned earlier, if someone's immune system's really primed and they have intestinal permeability, when you see tons of foods being positive like that are healthy enough foods that are not immunoreactive, it's really showing me there's intestinal permeability going on, and it's less to do with those foods. And what I have seen, and I've tested this, is that if you could test the next week or the week after, you'll see different foods lit up. So it's not really helpful to like, okay, take these foods out and it's sort of like this horoscope for their diet. It's not helpful because it's the overreaction of the immune system and less to do with those foods. Not that those labs don't have a place. I just think from a like real life, like what do you do with this data? It's not always helpful on the front end. Later on, I think those labs can really have their place whenever things have calmed down. And then you'll find like 2 or 3 foods on there that's just persistently irritating the immune system. So we're talking about months down the line after we've calmed things down. The one caveat to that, which is I think an important and interesting thing to talk about, it's the cross-reactivity labs for people that have autoimmunity. Yeah.
Oh yeah,
well,
I was going to say with Lyme, we've seen the certain tick-borne illnesses creating allergic responses. We mentioned it with beef.
The beef, yeah. No, those people for sure. And then those same people, these gluten-free grains, eggs, dairy, chocolate. It's the Cyrex cross-reactivity lab. And I think there's other labs that do it too. But basically, it's these foods that are low carb, these foods that are clean, these foods that are gluten-free, that are still for these people acting as gluten. So they're similar enough in structure on a molecular level that the immune system thinks that that healthy food is gluten. So if this person's getting like a celiac flare or an MS flare or ulcerative colitis flare, even if they've cleaned up their diet, this cross-reactivity lab is really helpful for people with autoimmunity and food reactivities and Lyme disease as a whole.
Yeah, absolutely. And in terms of we've done those panels. LabCorp has a food sensitivity panel now. So there are a couple of those out there. I certainly know that. But you're right. I mean, if somebody's like in an inflamed situation, I view very little utility. It's got to be like steady state, stable, baseline. And even then, when you're considering an elimination diet, it's tough to go down these rabbit holes. I mean, let's say you're considering an elimination diet, right? Fine, you could deal with the foods. What about the perfumes you use, the lotions you use, the soap you use?
Yeah.
What about the laundry detergent? What about the mold in your office, Brian? Right? What about there's so, you can go down a deep, deep rabbit hole of things, and it's tough. I'm not sure people just want to focus on diet and say that's it, but that elimination protocol could go very, very deep, and it's difficult. It's not easy.
Yeah.
It took me 2 years to figure that out. 2 years. Adjusting my diet, cutting out everything, elimination diet, and then it turns out I was exposed to mold.
Wow.
I get rid of the mold. I moved my office. Guess what? No problem. It cured my food allergies by moving.
Yeah, right.
It's
That's
ridiculous.
a good point. I mean, sometimes the food reactivity has nothing to do with intestinal permeability, or at least in fullness, it doesn't. So looking at these environmental things that are priming the immune system or stressing out an already stressed out immune system, it's super important. So start with food, but then lean in from there when you need to. Not everybody has to be that uncovering everything, but start with the practical stuff, like you said, and then lean in from there is what I would really advocate for people.
All right, I got 2 more quick questions, and then we'll call it. Okay, just a quick take on the benefit of A2 dairy for those who have issues with A1. A lot of times we have people who can't do lactose, and they can't do that specific casein protein, but they do well with A2 dairy, or they do well with fermented, the yogurt. So what's your take on dairy, and how do you figure out, okay, is it the lactose? Is it the A2? What is it?
So what I would do with somebody that has dairy problems, and they know they have dairy problems, or they have autoimmunity, and we're just erring on the side of caution there, I would have them remove it for at least 60 days. And that's short end of things. I would have most of them do it longer than that to really get to the place of let's decrease the variables as much as possible of things that could be potential irritators. So it's not just about dairy, but it's a multi-pronged approach. But then we do the reintroduction for many people. It's just as important as elimination, because if people want to have the dairy, if they enjoy the dairy, which it's one of those things that people really do want to try back in, then I would do a systematic reintroduction and start with the cultured, fermented A2 grass-fed stuff first, because that's probably going to be the least reactive. Well, before that, let's just say ghee. Ghee with a dairy fat is going to be the least reactive. But then after that, it's the cultured fermented A2 stuff. And then you're waiting a week with each one. You're very slowly doing a reintroduction. I find that that's more helpful than a lab. It's just really just track their symptoms. They're having it once, and then they're kind of waiting for a day. Because sometimes there's delayed responses. It's so accumulative that you have to allow these people to, their systems have time to sort of respond, because there's sometimes this delayed crescendo of like slow increase of fatigue or slow increase of digestive problems or inflammation somewhere in their body. So that's what I would start with. You're right. I mean, many people do fine with the fermented stuff, that they couldn't have like a glass of milk, but the fermentation and the grass-fed and the A2 varieties are fine. And then you could talk about goat's milk and things like that too, which tend to be more tolerable as well. So we try to give them as much wiggle room as their body will allow, but you have to give the body time to give you feedback to see if it's an issue or not.
I got two very specific questions. And again, guys, we can't give medical advice. So let's just be very clear. None of this is medical advice, but any experience with two very specific medical issues, one of which is burning mouth syndrome. We got this question. Any experience with that? Ever heard of it? Maybe not. And then the second one is eosinophilic esophagitis. Any experience with it? You know, so two maybe related issues, you know?
Yeah. I see all the very rare weird things sometimes, and not to say that's weird. I don't mean that you're weird, that whoever's going through that, but I'm saying the things that are like, they're not so commonly written about or talked about. But yeah, burning mouth syndrome and EOE are something that I see amongst a larger puzzle. I mean, that's just the check engine light. You mentioned that check engine light analogy. To me, it's like, yeah, something's going on here that is part of a larger inflammatory puzzle. It may have autoimmune components. I'm not saying everybody with EOE, and even though EOE is probably more recognized as autoimmune than the burning mouth syndrome, but both of these are on that inflammation spectrum. It may just be inflammatory and there's something going on. And not all inflammatory problems are autoimmune, but all autoimmune problems are inflammatory. So we have to look and differentiate that. But it's just a check engine light. We know something's going on, but we really don't know what's causing it. But when you deal with the larger, broader thing of going back to that earlier statement of what's irritating the immune system and decreasing the things in that mug as much as you can, those are the things that I would expect. And those are the things I track with patients to see decreased severity, decreased frequency of flares, where most people, when they start dealing with this stuff, if you're talking about 6 months, a year, 2 years for some people down the line, they can really start to say like, whoa, I have way more good days than bad days. And when flare-ups happen, they're not nearly as severe. Like that's the kind of stuff that I would expect for a case like that.
You know what I found amazing? So what I found amazing was I didn't believe this. I didn't believe that food and ways of eating could have an impact. But then you read the literature, and a low-carb ketogenic diet decreases TNF-alpha, decreases interleukin-6. These are medications. We have medications that target these things to decrease the immune system and kind of calm the immune system down. So, you know, I was like blown away when I'm looking at 2-year data from Virta showing that interleukin-6 and TNF-alpha are decreased. I mean, we just don't believe in the power of food.
Because you're decreasing visceral fat, Tro. Visceral fat is giving off interleukin-6, pro-inflammatory. That's why the cytokine storm, all this stuff. That's why I get smart kids like Nick Norwitz around me, because he's looking at all this stuff. He's look at the data and scour, because I don't have time. I want to take care of patients. But I have a quick question for you, Doc, with regard to burning mouth syndrome. Do you have a treatment? That's a really frustrating thing for patients and for clinicians, because we all say you're just stressed. When the stress goes away, you'll get better. Is there anything that you found that's beneficial, either a supplement or no? I mean, that's the standard.
Not specifically, no.
Yeah.
No, because
it's a hard one. I'm stumped.
I'm stumped too. It's a hard one. It really is. I always feel bad for people and try to get their stress better and life better and do everything we do.
It's multifactorial, but yeah, looking at stress, looking at the gut, looking at overall reactivities, looking at chronic infections, looking at mold. I mean, these are things that can create that upregulation of that immune stress. That it is typically not just one thing. It's normally a confluence of factors, or of course, decreasing stress can be a big needle mover. But I mean, looking at these other components too, because when you look at the components, some of them are going to be bigger needle movers than others, but you don't really know until you really bring them all into concert together and see what moves the needle for them.
Yeah, I've never seen anything get worse by decreasing stress levels. So that's a huge thing.
Yeah.
Really, IBS, irritable bowel syndrome, stress makes them all worse. There's no doubt about it.
Yeah.
Headaches, back pain, neck pain. So
Yeah.
after I see
Absolutely.
Pro,
I think that's it.
actually, I
I think
feel
that's
pretty
all we
good.
got time for now, you know?
Thanks, guys.
Listen, you know, if you keep causing this much stress to me, Brian, I'm going to get, you know, all these issues that we just talked about. So
Troy, I don't want you to get
if you want to keep your
hypotensive, man.
host,
I want to keep
if
your
you
blood.
want
I
to
know you
keep,
got low blood pressure. I'm trying to help you, man.
if you want to keep your co-host healthy, you know, you got to decrease the stress here.
No, it's always fun. It's always
And that's
fun.
that's a good doctor's prescription, not mine. So
Yeah, no, it's true. I'm telling you, like all this stuff. But Doc, hey, how do people get in touch with you if they need help? They want to know, you know, more about this stuff, or, you know, they just need some
Yeah.
adjustments or help.
Yeah, so everything's at drwillcole.com. We offer free webcam phone health evaluation there. There's tons of free content. I've written articles over the past decade on this stuff, so they can get it all there.
Yeah, that's awesome stuff. Thanks so much for joining us. I
Thanks,
love
guys.
your approach. I mean, you know, we're seeing more and more docs who kind of get this and say, how do we work together? I agree with you 100%. We're not at war. Most of us aren't at war with the registered dietitians and the, you know, it's like, hey, let's try to help each other and educate each other. Being adversarial, I think that's never beneficial for us, right? I say, look, here's what I'm doing. It works for me. You're doing that. It works for you. Cool. Let's figure it out. And sometimes they'll realize it's not working for them.
Yeah, absolutely right. I mean, the only person that really gets hurt with the sort of tribal adversarial approach is the patient, because they are so confused and they're the ones struggling. So we should get behind them and do whatever they need to move their health in a good direction.
Yeah, I think that's a
Absolutely.
good take home point. It's like, we can't sit on arrogance. If we're not helping the patient, we can't keep doing the same thing over and over. That's what we're doing wrong. It's like, hey, Will, can you help me? Coach, doc, whatever I want to call you. Can you help this patient? If you can, cool. Because that patient's gonna be happy and better and be there with their family and kids and grandkids and all that stuff. I think, you know, this tribalism really, it's very, very dangerous, really. And you know, we gotta get accused of tribalism, but I'm like, hey, if it works for you, cool. I don't care. If you're, I personally, after looking at all the data and my clinical experience, like whatever you can do to decrease inflammation, visceral fat, autoimmune stuff, then it's going to work probably, unless you have a food allergy or some weird combination of things.
Mm-hmm. Yeah, well said.
thank you so much for coming. This has been great. This is awesome. Love it. Absolutely love it. And this is a big deal. I think autoimmunity is an unexplored frontier, not been explained by conventional medicine, and people are suffering. So it's great to hear this kind of message. And I wish we had more data to say, hey, look, you know, we have some data, but just we need more. We need more.
Yeah, I agree.
So absolutely. Thank you for everything you're doing. Thanks for coming on.
Thanks, guys. Appreciate it.
Thank you. Patreon supporters, thank you. Thank you for joining us early in the morning, West Coast. This is good stuff. I'm so glad you get to hear this, and thank you for your support. We appreciate it. You help float the boat, and we get great guests like this so that we educate other people, because all these nuggets, all these things that are going out there, you know, we all benefit from that, learning from each other. So Dr. Cole, thanks. Keep Jason Fung in line. We're trying to do it on our side, and we'll keep going from there.
Thanks,
Listen,
guys.
if you ever need help, you know, on the medical side of things, we have, we're licensed in Pennsylvania. So if you ever need a collaborator, let me know.
You know what? That means a lot. I definitely will. I'll be reaching out to you. What's the best way to get in contact with you?
Just text me. I'll send you my number.
Yeah, email me your number. We'll stay in touch.
Have a good one. All right, guys.
Thanks, guys.
Have a good one.
Bye. All right.
Bye.